ALARA, as low as reasonably achievable. Presented by Malia Santiago and Cristina Velasquez. Presented to Gurnick Academy. What is ALARA? ALARA is a principle of radioprotection stating that whenever ionizing radiation has to be applied to humans, animals, or materials, exposure should be as low as reasonably achievable, while still maintaining a suitable image quality for diagnosis. In 1950, the International Commission of Radiological Protection, ICRP, introduced an effort to reduce exposures to all types of ionizing radiations to the lowest possible level. Recommendation applied to not only X-rays and radium, but also to beta and gamma radiations newly covered by ICRP at the time. In 1966, ICRP further tuned the concept to be as low as readily achievable, which was finally shortened to become the renowned phrase of as low as reasonably achievable, ALARA, in 1977. Cardinal rules, the three cardinal principles: time, distance, and shielding. Cardinal rules. Principles applied to both the patient and the radiographer. Time. Keeping exposure times as short as possible. Complete your work as quickly as possible and leave the area during exposure. Distance. How close you are to the radioactive source. Increased distance equals decreased dose. Maximize your distance from a radioactive source as much as you can. Maintain a large distance between the patient and the exposure field. Shielding. Barrier between person and the radiation source. Employ shielding devices when necessary. Responsibilities. Occupational practices should align with ALARA principles to maximize diagnostic benefits and minimize potential risk. Both employers and employees must take responsibility for radiation safety. Employers must provide resources for an effective safety program. The Radiation Safety Officer, RSO, is responsible for enforcement, execution, and maintenance of the ALARA program. Myths and controversy. In recent discussions, there is an ongoing controversy regarding the use of lead shielding with patients. For more than 70 years, radiologists have been concerned about the effects of radiation from imaging exams on patients' reproductive organs, specifically its effects on sperm or eggs, and that the effects would be passed down to future offspring. As a result, lead-based shields were placed over patients' reproductive organs during imaging exams. Advances in technology suggest it is now safe to radiate patients without a shield, as they emit 95% less radiation as to before. Myths and controversy. Problems with shield placement. Shields are said difficult to place properly and may constrict areas of the body the radiologist needs to view. Undiagnosable images may cause repeat exams, therefore exposing the patient to more unnecessary radiation. Much of the radiation received by reproductive organs during imaging is from secondary radiation, resulting in the radiation beam intercepting body tissue. Shielding offers no protection from the secondary radiation. Automatic controls, AEC. Controversy continued. Most modern X-ray machines, CT scanners, and other imaging equipment automatically determine how much radiation is required based on the part of the body being examined. However, if a shield or other object is placed in the path of radiation beam, the machine can be tricked into drastically increasing the beam intensity, resulting in a much higher dose to the unshielded tissue. Because patients have become accustomed to shielding, the practice of phasing out shields will have to be a gradual process.
The radiation dose from a single X-ray is minimal. The chances of someone being diagnosed with cancer from diagnostic X-rays depend on the type of X-ray, the dose received, and individual sensitivity. However, even small doses from X-rays might slightly increase the cancer risk, according to the linear non-threshold model. The likelihood of an X-ray tech being diagnosed with cancer as a result of occupational radiation exposure is generally low due to strict safety protocols and regulations like ALARA set in place to minimize radiation exposure for both patients and healthcare workers. Being involved in a car accident or developing health issues unrelated to radiation exposure are more likely than being diagnosed with cancer from diagnostic X-rays. Statistics suggest that approximately 1 in 3 people will receive a cancer diagnosis at some point during their lifetime. Cancer's development is unpredictable and not always directly linked to specific behaviors or exposures. Our goal as radiographers is to minimize radiation while obtaining accurate diagnostic images. Both patients and radiographers benefit from practicing ALARA principles. Following the 3 cardinal rules, time, distance, and shielding, will ensure that radiation exposures will be reduced as low as reasonably achievable.